Hello, welcome back to my channel. My name is Susan and I'm so happy that you are here. If you are new here, I am a first-time mom to my daughter Julia, and I was also diagnosed with a brain tumor when I was 3 months postpartum. My channel consists of motherhood, navigating a brain tumor, and just trying to live life because it is so fragile and short. So while I'm on this wild journey, I am documenting it and sharing it with you. My primary goal of sharing my medical experience is because when I was diagnosed with a brain tumor, I searched the internet high and low for someone who had a similar experience, and there wasn't a lot out there. I was walking blindly into this experience, and I don't want anyone else to feel that they have to walk this journey alone, whatever it is. I know that some diagnoses are every diagnosis is very different and brings an onset of a bunch of different emotions, feelings, changes in your lifestyle. But I am just trying to be transparent with my journey. So if anyone is in a similar boat, they know that they are not alone. And also, a lot of the things I am navigating aren't exclusive to having a brain tumor. So I just want to give you that forewarning. I also am married to my husband, Chris. We have a dog named Maggie, and we live in New England. So with that said, let's get into today's video. This is a neurology update. I had this appointment 2 weeks ago now, but then Julie and I got sick, so I wasn't able to record. So let's catch up. I am actually breaking up a lot of what we talked about in this appointment into a couple different videos. There's just a lot of information, and I think by breaking it down into subject, it's going to be a lot easier to digest, and also it's going to cater better to my audience based on what they want to know about. So today, the big update from this appointment was I was diagnosed with epilepsy. So the backstory on this, if you've been following this journey from the beginning, my very first video explaining what happened, how I was diagnosed with a brain tumor, and it was also being diagnosed with epilepsy. And then somewhere in the middle of all of these medical appointments, it was deemed that I don't have epilepsy. And then at this appointment, it was reiterated that I do have epilepsy. So this is the backstory if you are new here and you haven't seen the older videos. I'll make it quick as a recap because those of you who have been here, you know the story. On October 18th, I had a grand mal seizure. I lost consciousness. They had to call 911. They brought an ambulance. They took me to the hospital. At the hospital, I had a CT scan. That is where they were able to see that the seizure was real. Apparently, people fake these all the time. When the doctor came in, he was like, "No, we can confirm that you did actually have a seizure, because we can see like the brain damage from where it started to where it ended, and it crossed from one side to the other." And I remember asking him, I was like, "Why would I fake that? Why would I piss my pants and fake something like this?" And he was like, "You would be surprised at how often that happens." I was like, okay. He diagnosed me with epilepsy in the ER, and they also found the tumor, but they didn't know what it was. So I was transported to another hospital where they could give me the scans and imaging I needed to get a better diagnosis. I was transported to this other hospital. They supported the idea that I have epilepsy. I will say, I met two doctors when I was in that hospital. One was a neurosurgeon and one was a neurologist. The neurologist that I met with, I was in and out, like I was asleep and awake. It's kind of weird to me that he started his like presentation communicating with us while I, the patient, was asleep. 10 out of 10 wouldn't recommend that hospital at all, actually, for a variety of different reasons. But that specifically, he was talking to my husband. And there's a couple different layers there. As a woman, and a patient, like as the primary patient, I want to be spoken to. If I'm asleep, wake me up or come back when I am like fully with it, you know? And then speak to me, not my husband. I understand that I was I was not in the best state. So I do kind of understand talking to him, but he's not my keeper. Again, I'm the patient, talk to me. He can bounce ideas, he can ask questions if he has them, but the primary person you should be talking to is the patient. Anyways, he was also, I don't want to be ageist. He was older, so maybe that was a factor in it. I don't know. Actually, I don't know. I don't know if he agreed or not because I, again, was kind of like in and out of it. The neurosurgeon that I met there said, I don't know what this is, but I wouldn't, and I quote, I don't know what this is, and I wouldn't touch it with a 10-foot pole. That was enough for me to be like, you're right. You're not going to touch it with a 10-mile pole. He agreed that I had epilepsy. So I mean, and don't get me wrong, I actually liked this neurosurgeon. For my first experience with someone, he was very charismatic, he was energetic, he was kind, like his bedside manner was really, really great, with the exception of saying I wouldn't touch that with a 10-foot pole. But I really did like him. So when he said, yes, you have epilepsy, I was like, I will take that piece of information from you, sir. Thank you. Now I get transferred. So now I'm discharged, and now I have established myself as a patient at a different facility. So now this is the second neurosurgeon that I'm meeting. This was the first like real doctor's appointment that I had had since being discharged from the hospital. I really like this neurosurgeon. Seemed much more knowledgeable than the one I had met prior. So he went through my scans with us and explained things. He went through like two slides of the images that we had and showed us where the tumor was, answered a ton of questions. He said in that first appointment, I don't think you have epilepsy. I think all of this is tumor related. So there was just like a sigh of relief. It was like, we can take that off of the plate of stuff we are dealing with right now. And that felt good. It was like one less thing that we had to worry about, one less thing. And then it also felt like, take the tumor out, in theory, seizures stop, and I go back to regular life. At this point, we knew that my vision would be, it was kind of jeopardy on taking it out, how that would be affected, but it wasn't a guarantee. And he seemed very confident in that first appointment that we could just kind of let it sit, get me adjusted to the anti-seizure medicine, see how I'm feeling, but not touch it at that time. I was like, I love everything I'm hearing from you. Unfortunately, things have changed and that is not what we're doing. So now fast forward. So that appointment was in October. Now it is February. So I met with my neurologist. So I'm sorry, I skipped an appointment. I met with my neurologist in the middle of December. We went over all of the issues I was having with the anti-seizure medicine. He agreed to switch me on to a new one. Again, if you are new here, that is a very long process. I'm currently on Keppra, was the original anti-seizure medicine, and they are transitioning me on to lamotrigine. That is a long process. You can't just start taking a high dose. You have to start at 25 milligrams and build your way up. The building process takes weeks, especially to match. My Keppra was at 1,000 milligrams, so it takes 8 to 10 weeks to build me up to where I was supposed to be with the lamotrigine. I had my blood work done, and my lamotrigine levels are not where they should be, which is not surprising because I'm still having breakthrough seizures on a pretty frequent basis. That was not a huge surprise to us. So they are now increasing my lamotrigine again, and it'll again take a couple weeks. We'll do more blood work and see if my levels are where they're at. And then at that point, we start to wean me off of the Keppra. I'm on 2 anti-seizure medicines right now, and I'm still having seizures. That is obviously a problem. And another factor that goes into the treatment plan process and choosing a treatment plan is, if I get to a very, very high dose of these anti-seizure medicines and I'm still having any form of breakthrough seizures, then that is a deciding factor that we need to do something else. We need to take it out. We need to do some sort of treatment that is more than just medicine, which I'm going to get into the whole what our treatment plans are, A, B, and C, in a separate video. At this last appointment that I had, we're talking over everything, checking in, and he made a comment about epileptic seizures. And that stopped me. And I said, well, wait, do I have epilepsy or not? Because I was told I don't have epilepsy. Like, originally I was told I had it. And then at my first neurosurgeon appointment, he told me I don't have it. And he said, oh no, you have epilepsy. And he honestly looked confused that I didn't know that. So the seizures are because of the tumor, but they are epileptic seizures. So let's get into what is epilepsy, because I had to Google this because now I'm being thrown all these different terms. I thought epilepsy was just a seizure disorder. I didn't realize that tumors can cause epilepsy. So I'm just going to read you the description of epilepsy, and I will also draw the connections to how it affects me and how I do have symptoms and signs of this. I'm also going to put this, I'm going to put it on the screen here for you to see, but I'm going to read it to you as well. Epilepsy is a chronic brain disorder characterized by recurrent seizures, which are brief episodes of involuntary movements, loss of consciousness, or altered awareness. That's the baseline definition for epilepsy. Causes for epilepsy. There's a bunch of different factors. So genetic mutations, brain injuries like trauma or stroke, brain tumors, ding, 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 that's the one that's affecting me. Infections, developmental disorders, or in some cases may be unknown. There's two things here that affect me. So one, I have a brain tumor, but they're going to do blood work and rule out a infection. Yeah, I think infection is the right word. That can be caused from consuming undercooked pork. I do not believe that aligns. I don't eat a lot of pork to begin with. Definitely not undercooked, but obviously you never know. There could be that possibility. And by doing this test, it just rules it out. And it's very easy. It's just lab work. So I am lined up to get that done so that they can just rule that out. But that would be under the infections category. But we know I have a brain tumor. So that is the primary cause of it. There are many different types of epilepsy. They are classified based on location, duration, and severity of seizures. There's 3 different types. There's generalized seizures, which are, for an example, tonic-clonic, absent, or myoclonic. So tonic-clonic is what I had on October 18th, where I lost consciousness, convulsions, wasn't responsive. I never stopped breathing. But like I said, completely unconscious and no control over my body, bladder loss, like peeing my pants, the whole 9 yards. The next group is phallic seizures. These are partial or in temporal lobe. So these are also seizures that I've had. So in my life, I've had 3 generalized seizures. Once when I was 2 or 3, I fell up a set of cement steps. I hit my chin and I had a seizure. 7-ish, I slipped on the tile coming in from the pool and I slipped, hit my head, and had a seizure. But that one was super brief. I don't think I even went to the hospital for that one. And then obviously the one that I had in October. So now back to the focal seizures. I'm sorry that I'm jumping around a little bit. Tumor is in my occipital lobe, but I experienced partial seizures. That's what I'm experiencing now. And that started at 2 weeks postpartum. For reference, I had my daughter in July. So by the middle of July, I was having partial seizures multiple times a day. As my stress level increased with my daughter starting daycare and going back to work, and then just the compound stress of all of that, I was having up to 15 a day, sometimes lasting up to 5 to 10 minutes. The longest one I had lasted 40 minutes, and that was 2 weeks before my grand mal seizure. So I fall into 2 categories of it. And then there are febrile seizures, which are in children. Symptoms of seizures. They can vary and are widely different in severity and symptoms, but there's sudden loss of consciousness, involuntary muscle movements, staring spells, confusion, aura, which is a warning sensation before a seizure. I thought that my seizures were auras to migraines, which they were not. And I have a whole TikTok video showing you exactly what they look like. This is what it looks like to have a brain tumor from my perspective. My tumor is in my occipital lobe, which controls the right side of my vision. Everything I'm about to show you is only ever on the right side of my vision. And what I'm seeing is actually seizure activity caused from the brain tumor. When I was 2 weeks postpartum, I started seeing colors like this. I thought they were ocular migraines and assumed they were hormone related. As going back to work got closer, I started getting more stressed, and it turned into something like this. These bright, flashy lights would kind of move in a circular motion, and it would take up to 80% of my vision on my right side. And they were more circular like this. By the time I got back to work, this was happening up to 15 times a day. And then directly after this would happen, I would have this blurriness that would last up to 10 minutes. This is a really good image of like what it would look like when it was happening. This is another pretty accurate representation of what was happening. This was happening every day for months, and then I had a grand mal seizure, which is what diagnosed the tumor. Questions in the comments. And then changes in behavior or mood. So the tonic-clonic grand mal seizure that I had sudden loss of consciousness, involuntary muscle movements, staring, spell, confusion when I woke up. I had the aura before, and then obviously changes in behavior and mood. I mean, I was just out of it, but that's just post-ictal state, I believe. Changes in behavior and mood. This is my number one precursor to a series of seizures. I get angry beyond measure for absolutely no reason, and it's usually first thing in the morning. Irrationally angry over nothing. And I mean, like, don't get me wrong. As a human being, we feel anger for whatever reason. You know, I have a dog, a husband, and a child. Sometimes my husband does things that just piss me off. Sometimes the dog is just fucking annoying. I don't really get angry with my daughter, so I have to skip her. But there are just things in life that cause anger, right? But this is like blood boiling anger with no reason. Chris is being so kind and nice. The dog is not barking. Julia is smiling, and I'm seething. Like, just want to crawl out of my skin angry. And that's not me. That is not my personality. That does not align with who I am. So that is my number one like indicator. I'm probably gonna have some episodes today. That I did not know was a sign until weeks or I guess I connected it. There's a TikTok like video of me saying I woke up really angry and then I had a bunch of episodes. But I didn't really draw that connection until recently where I was like, oh no, like I get so angry and then I'll have a series of events. So had I seen a video explaining that, you know, mood swings, behavior changes, anger are signs that I'm going to have a series of seizures or just a seizure in general, I think I would have been made more aware of that. Again, another reason why I'm sharing this journey. So, diagnosis, medical history and physical exam, and a EEG, which records brain activity. I'm actually having this done soon. I will document that experience, despite the fact I'm probably going to be pretty embarrassed about how I look while they do it. I'll wear a little backpack and I will have electrodes stuck all over my head for 24 hours. It tracks all of your brain activity, sees any seizures that are happening. Hopefully there are no seizures happening by the time that happens, because I should hopefully be fully adjusted to the dose of the medicine that I'm on. And then imaging testing, MRI, to rule out underlying structural causes or identify brain tumors, which I also had that done. So we really covered the bases there. And then treatment. First line of defense is anti-seizure medicine, which is what we're doing now. Second line of defense is lifestyle modifications, which you would be surprised at the impact lifestyle changes can have on your physical and mental well-being. Small things too. It's obviously my life changed drastically when I was diagnosed with a brain tumor. However, the little habits and lifestyle modifications that I've made since have really drastically improved my quality of life, but also are helping with the seizure activity. So lifestyle modifications, that the two big ones are sleep hygiene and stress management, which this is where every single doctor that I've seen across the board have said, well, your case is really peculiar because you are a new mom, so you don't get a lot of sleep or you don't get a lot of consistent sleep, and you're naturally stressed. Like, you are responsible for an entire new human being. You're learning, your whole life changed with becoming a new parent, and then try not to stress about it. Piece of this that will be a separate video is the financial stress that comes with a diagnosis like this. And this is just transparency. Like, I had no idea what it was going to cost to have a brain tumor. And it's like, you can't just skim or skip out on these testing and doctor's appointments. Again, sorry, off track. And then surgery. So there's 3 different type of surgical techniques that they can do to help with your seizures. One is just taking out the tumor completely, but that's not guaranteed to take away the seizures, because seizures are caused between the healthy tissue, healthy brain tissue, touching the damaged or unhealthy brain tissue caused from the tumor. So even if they take it all out, there's still going to be damage left to my brain, and that damaged tissue touching the healthy tissue is what causes the seizures. Then there is laser therapy. I am pretty sure that is not an option that we're going to take. It sounds less invasive. However, there's actually more opportunity for infection or things to go wrong, because with the laser, they have to obviously make the incision, then they have to put in essentially like hollow tubing, and then they put the laser in. So that's 3 different entry points into your brain. That's 3 different ways they can touch things that they're not supposed to. And then with a laser, they could melt something that they're not supposed to. Which, again, it sounds less invasive, like laser therapy, but it actually could cause more harm than good. So that one's on the very back burner. And then there's another one that they just told us about in this neurology appointment, where essentially they go in surgically and then they kind of like electrocute all around the tumor. And that is kind of the idea is to block the electric, I don't know how to describe it. It's to block the frequency from the healthy tissue to the damaged tissue. So that is an option as well. So where that leaves us is I have a brain tumor and I have epilepsy. I believe I will have epilepsy for the rest of my life, even if we are able to take out the brain tumor. And I will cover all of that in greater detail in another video where I talk about the brain tumor treatment plans and options and how we're moving forward. So thank you so much for watching. I cannot express my gratitude enough. You watching is helping contribute to my family during this difficult time that we're trying to navigate, and doing these updates is really helpful when I have a lot of people that care about. I'm so fortunate to have so many people, both family, friends, and connections that I've made on the internet who care about what's going on. It's a lot easier for me to make an update, and when a handful of people are asking, I can say I cover all of it in great detail on this video. So thank you so much from the bottom of my heart for watching. I appreciate all of your love, support, kind comments, thoughts, and prayers. Seriously, it means so much to Chris and I will see you in the next video.